Yes, as you mentioned, we're going to be talking about glutathione and the liver. If you want to just take a little note of those internet addresses there is a Facebook page that I update every couple days, always new research on glutathione. Of course, there's a website where you can order my book from. And finally, there's a YouTube channel that I manage that will have this video eventually posted and all the previous conferences that we've done on many different topics and much, much more for you to get into. So let's get into glutathione and the liver. Next to the skin, the liver is the largest organ in the body. It's about the size of a football and weighs on average about 3 pounds. It's both an organ, but it's also a gland, since it secretes chemicals that our body needs, including proteins, hormones, and much more. The liver plays many roles, including cleaning out toxins out of the blood, getting rid of old red blood cells. It makes bile, a fluid that helps the body digest and break down food. It metabolizes proteins and carbohydrates and fats so your body can use them. It produces substances to help blood clot. It regulates the amount of blood in the body. It stores glycogen, which is an energy source, and vitamins to be used in the body later. We can continue on and on to list its roles, but these will give you just a smattering of an idea of how important this organ is. One of the primary roles, as we mentioned, is to remove toxins. The list of toxins is actually quite huge. Everything from the breakdown products of medication like acetaminophen, statin drugs, non-steroidal anti-inflammatories, to chemotherapy. Many toxic alkaloids found in plants and mushrooms, pesticides, herbicides, heavy metals, automobile exhaust, anything that gets into the blood is filtered and processed by the liver. And this detoxification process is often regarded as taking place in 2 phases. Phase 1 is the breakdown of fat-soluble toxins by certain enzymes, and phase 2, conjugation or bonding with certain biochemicals that make them water-soluble, therefore easier to get out of your body. Now, please look at the nutrients needed for accomplishing these 2 phases. You'll see a list of vitamins like B2, B3, B5, B6, B12, folic acid, all of which are contained in a quality multivitamin. You'll find flavonoids that are found in our reds and greens product, but you'll also see a list of amino acids like cysteine, methionine, glycine, glutamine, and others. Please be aware that these can all be obtained from Immunical, a non-denatured whey protein isolate. And finally, glutathione is needed in both phases and is likely the most important of all of these. Let's shift to storage, another critical function. This is one that is often overlooked by most people. When we eat, much of our food is broken down into glucose, our main source of energy. But whatever glucose is not used is usually stored in the form of something called glycogen. This is stored in the liver and is used when glucose levels drop. So view it as a slow release form of blood sugar. The liver also breaks down red blood cells as they age and get damaged. The liver stores this iron that comes from this and recycles it as necessary. Fat-soluble vitamins such as vitamin A and vitamin D, vitamins E, K, B12, and folic acid, these are all stored in the liver. And this is just a short list of nutrients that are made available to the rest of our body, which are stored in the liver. The metabolism of food into energy is a rather complicated process, certainly beyond the reach of this discussion, but the liver is tightly controlled by insulin and other metabolic hormones through an intricate network of biochemical reactions. This includes both the processing of sugar, the synthesis of sugar, the processing and synthesis of fats, cholesterol, fatty acids, triglycerol, ketones, and much more. You could read about this on your own time if you are interested. Our livers are also a source of many, many different proteins. Again, these are produced by the metabolic transformation of the foods that we eat. Just to look at a short list here: albumin, haptoglobin, transferrin. The liver is constantly at work manufacturing these proteins from the breakdown and rebuilding of our nutrition. And blood clotting substances, acute and chronic liver disease, are inevitably associated with blood clotting or coagulation problems. That there are multiple causes, including decreased synthesis of clotting and inhibitor factors, decreased clearance of activated factors, quantitative and qualitative platelet defects, hyperfibrinolysis, and accelerated intravascular coagulation. Again, this gets a bit complicated, but at least be aware of the role of the liver that is played out in these processes. Now, the liver is easily damaged. Different stages of liver damage shown here are, first of all, a fatty liver, otherwise called steatohepatitis, which about a third of you already have, a third of you. Fibrosis, where scarring has taken place. Cirrhosis, where the scarring is more complete and the liver starts to actually harden. And finally, cancer, which is the ultimate in a damaged liver. One of the things that can happen is through what we call toxic hepatitis. The term hepatitis refers to any inflammation of the liver to one degree or another, and the term toxic refers to something that is coming from outside the body to cause this inflammation. Although there are many forms of toxins, let's take a look at three major categories. 1, alcoholic hepatitis. 2, hepatitis that results from the intake of drugs, or what we call medicinal hepatitis. And 3, chemical hepatitis. Let's look at chemical hepatitis first. The list of potential toxins is huge. Even things that you use in your house every day: solvents, fungal growths, paints, your carpets, all of these contain potential toxins. Look at this short list, okay? So let's look at this list: carbon tetrachloride, chloroform, vinyl, solvents, certain mushrooms, heavy metals, and more. Your liver is quite sensitive to all of these. Now look at this. Please don't be surprised that glutathione is responsible for the detoxification of all of these substances shown. The number of potential toxins detoxified by glutathione can't even be quantified. The list is really endless. And for this reason, I tell people that next to water, there's no more important detoxification substance in our body. And of course, the highest levels of glutathione in our body are to be found in the liver, which is our most important organ of detoxification. Now, let's look at acetaminophen, which is actually the most common cause of medicinal hepatitis. Acetaminophen is known by different names, including paracetamol, Panadol, and others. There are many name brands, the most popular being Tylenol and Adasol, but there are many, many others. In fact, acetaminophen shows up in literally hundreds of different products. Now, most people would think that Tylenol or acetaminophen is a safe medication with little toxicity. That is absolutely not true. It is the most commonly used medication in an intentional overdose and quite deadly. A big old bottle of extra strength Tylenol will kill most of you out there and is a very successful way to overdose. And the way it kills you is by destroying your liver over about 5 or 6 days through oxidative stress. You see, taken in small quantities, the liver can easily process acetaminophen into safe metabolites that work to relieve pain. Here in the chart, acetaminophen is abbreviated as APAP. You see it there? But when taken at massive doses, the liver is overwhelmed and the metabolism gets shunted down a different pathway, which results in acute liver damage. This can lead to the death of hepatocytes or liver cells. The way that doctors treat this, well, the antidote is glutathione. I can keep you alive by raising your glutathione levels if I can get my hands on you within 24 to 48 hours. So most emergency physicians are familiar with glutathione as a way of treating acetaminophen overdose. Let's turn to alcoholic hepatitis. This is a chronic condition which results in a number of different symptoms. Any trained doctor can recognize these: a bloated belly, breast tissue formation, distinct skin features, jaundice, a tremor, and more. Issues include esophageal varices, which can cause severe bleeding and death, altered consciousness, confusion, agitation, and so on. The actual prevalence of alcoholic liver disease is a shocking 5% of the world population. And untreated, the survival rate is only about 5 years. In this Italian study, researchers studied patients with chronic alcohol abuse, and this study was confirmed by many other studies. Both alcohol abuse as well as those with alcoholic cirrhosis had severely depleted glutathione levels. Let's use this as a baseline for further studies. In another Italian study, the Italians do a lot of work looking at glutathione, used this information as a jumping off point. After much investigation, they concluded that glutathione could be a promising strategy to recover from oxidative stress-induced liver disease, including alcoholic liver diseases. And this has been followed up with many more studies. Looking at infectious hepatitis, there are certainly a lot of infections that can cause this problem. Usually when somebody uses the word hepatitis, they are referring to infectious hepatitis. Most of these infections are viral, although there are bacterial causes as well as parasitic causes as well. Let's focus on the most common cause, viral hepatitis. Here we see hepatitis A, hepatitis B, hepatitis C, as well as D and E forms. but the vast majority of hepatitis fall into the A, B, and C categories. Hepatitis A is usually spread by fecal contamination of food and drink. There is a vaccination available. Recovery, fortunately, leads to a lifelong immunity to catching it again. Hepatitis B is translated by blood-to-blood contact or by sexual contact. Again, there is a vaccine available. Finally, hepatitis C is from blood-to-blood contact. Although there is no common vaccine, there is treatment available that can be quite successful. Although the symptoms of hepatitis may vary slightly depending on whether it's A, B, or C, there are some common features: nausea, vomiting, stomach pain, loss of appetite. These are all common. You may become jaundiced, which means you take on a yellowish color. You may notice that your urine is getting darker, but your stool color gets lighter. Now, hepatitis C is a bit different in that most often there are no symptoms at first other than general fatigue or depression. This actually makes it more dangerous because you're not aware that you have it, so transmitting it to another person becomes even greater. Are viral hepatitis patients low in glutathione? Absolutely. This has been shown for many years. Not only are they low in glutathione, but this article is one of several that shows a correlation between glutathione levels and viral load. In other words, the more viruses you're carrying, the lower your glutathione levels will be. The next question is, will raising glutathione have an antiviral effect? Again, this has been demonstrated many years ago. In this study, researchers used the glutathione-enhancing drug NAC to raise glutathione. Results were clear that the virus was knocked back. Here we have an Immunotech study. A team of Japanese scientists were investigating the effects of Immunocal on chronic hepatitis. They observed that liver function tests were reduced. In this case, elevation of liver function tests represented liver damage, so this was a good thing. And glutathione levels were increased, as expected. Serum lipid peroxide levels also decreased, a reflection of oxidative stress, which is what you want to see. And finally, interleukin-2 levels and natural killer cell levels increased, including a stronger immune response. These are great results for sure. Let's take a look at fatty liver development, or otherwise called steatohepatitis. This is actually very common. Probably 30% of the people listening to this call have some degree of fatty liver. More often than not, it's associated with a poor diet, which is rich in sugar and fat. And certainly it's more common in those with high cholesterol. The most common cause is obesity. Actually, there are two main categories of fatty liver: non-alcoholic fatty liver disease, or NASH, non-alcoholic steatohepatitis, and two, alcoholic fatty liver disease. Let's focus on the non-alcoholic type. Are these people suffering from low glutathione? Absolutely yes. This study clearly showed a significant decrease in glutathione levels in patients suffering from fatty liver disease. And this has been repeated many, many times. And here we have Another Immunotech study, patients with non-alcoholic fatty livers were fed 20 grams or 2 pouches a day of Immunical for 12 weeks. At the end of the study, they had improvements in their liver function tests, increased glutathione levels, and reduced hepatic microvascular steatosis. Results were apparent. Immunical was helping these patients. So let us summarize briefly. Glutathione is a critical component of normal liver functioning. Without it, the liver would rapidly break down. Low glutathione invites a whole bunch of toxicological problems and also a number of immunological diseases. We looked at some of these, including viral hepatitis, alcoholic liver disease, fatty liver, just to mention a few. Finally, it's been demonstrated that raising glutathione offers a treatment option for these issues. So certainly the ingestion of Immunical, which raises glutathione, is a very valuable alternative to standard treatment. So thank you very much. And again, feel free to visit these websites. Of course, there is a book available. There's a whole chapter on liver disease and many other chapters for you to enjoy.